Vancouver Coastal Health, promoting wellness, ensuring care.
When setting up a wheelchair for hemi-propelling, you need to balance the needs of seating with the needs for efficient propulsion. Sometimes the seating needs will conflict with the mobility needs, and this is when you have to use your clinical reasoning to determine the optimal setup for your client. So complete your MAT assessment, your measurements and your goals as you would for any other client to establish the seating objectives, and then consider the mobility needs for hemi-propulsion. So for example, the seat width. A tighter fit rather than a loose fit is better to give adequate lateral stability and also a closer access to the wheel rim. So keep the width as narrow as possible. For the seat depth, you'll require less depth to allow for enough clearance for foot propelling. A good starting point is about 4 inches shorter than your measurement from the buttocks to the popliteal fossa. This gives enough clearance for foot propelling. A foam cushion is typically more appropriate to allow for more stable base rather than something like a roho, which is an air cushion, which provides more pressure relief but less stability while you're wheeling. Of course, if the client has skin issues and requires a pressure relieving cushion, that will take priority. The cushion may need to be cut down on the leg trough for the propelling foot or built up under the leg that's supported by the footrest. So I have an example of a cushion that has been built up to support the leg that's under the footrest, and this one is lower, so the leg trough is lower for the propelling foot. That's an example of modifying a cushion. So make sure that the front edges of the cushion don't touch the back of the calf when wheeling. A seat rigidizer will help with positioning, but tends to increase the seat height. So use a smaller rigidizer that fits between the rails rather than on top. So this is between the rails, and it still creates a firm base versus on top of the rails like this. Makes it up higher. For seat height, we found that the height of the cushion when sitting on it to the bottom of the shoe is 1.5 inches less than the measurement of the popliteal to the base of the shoe. This tends to allow for the most efficient pull, but needs to be assessed individually. So if your client tends to lean on their backrest when wheeling, a small amount of dump will help keep their pelvis near the back of the seat. So you can see that there's a tapered wedge here. Conversely, if the client sits up while wheeling, a slight anterior dump will help to encourage a neutral pelvis. And also an anterior dump opens up the hip angle, making propulsion easier for people with tight hamstrings. So I'll just change this around. This is for the visual, but you would potentially be changing the angles on the actual seat, not the cushion, to achieve the anterior or posterior dump. Both of these wheelchairs have the same seat to floor height. Here and here. This cushion would be pushed down just a little bit, but they're the same height. So a seat to floor height can be achieved in a number of different ways, and some make it easier to wheel than others. For example, a low profile cushion and or a dropped seat, they lower the seat to floor measurement and can allow for bigger wheels and casters. So you can see that these wheels and casters are much bigger than these wheels and casters. And bigger wheels make wheeling a lot easier versus only using small wheels and casters to keep the seat low, which will make it harder to wheel. However, a small caster doesn't interfere with foot propelling as much as the larger caster does. So when this foot is propelling, it may get caught. So there's always advantages and disadvantages of your wheelchair setup. For the wheel position, when foot propelling, you want the wheel to be as far forward as possible. So it's important to have an axle adjustable wheelchair. So in this area here. This will need to be assessed for each individual as the center of mass is different for different bodies. Wheels that are forward make propelling and maneuvering easier, but the chair more tippy, so the anti-tippers are required. For the backrest, you will likely need a solid back versus a sling back to promote adequate support for foot propelling. This can also help shorten the seat depth. So for footrest, the problem with having a chair low enough to foot propel is the footrest often catches on uneven ground. Having a hanger that's not straight down, for example 90 degrees, but more extended, such as the 60-degree angle, can help. For the hemiplegic arm, you'll need to support the hemi hand, arm, and shoulder with a half lap tray or even a full lap tray. You may need an elbow block like this one, or a medial block, which would be on the inside here, to optimize positioning. And a seat belt can help maintain pelvis from sliding into posterior pelvic tilt, but it needs to be angled vertically and snug, not as a restraint, but as a positioning device. For your observations and documentation, what are the goals for mobility? For example, is it wheeling around the unit indoors on level surfaces? Or is it going to the coffee shop that involves going outside and on uneven ground? How far and how long can the client wheel for? Do they have decreased sensation? And where are the pressure points and shearing when wheeling? Is propelling increasing their tone or pain? Is propelling feeding into their stroke presentation? Do they have inattention to one side? Has the seat height impacted their ability to stand up or transfer because it is a lower seat height than regular? If yes to any of the above, is there anything that can be modified to meet the unique needs of your client? For example, changing the seat depth, the cushion, seat height, or wheel placement. If hemi-propelling is disruptive to the client's motor recovery, consider temporary or long-term power mobility. You may also recommend short distances for self-propelling, but portering or family assistance, or even power mobility for longer distances.